Good evening. My topic is a novel technique for indirect prediction of screw length in scaphoid fractures, morphometric analysis using MRI. Internal fixation of scaphoid fractures requires central placement of a screw of precise length. Scaphoid fractures are often missed on radiographs, and it is difficult to assess the scaphoid length on radiographs due to its twisted profile. The aims and objectives of our study were to predict the length of the screw for fixing scaphoid fractures and to analyze the correlation between the axial length of the scaphoid and the axial length of the middle phalanx of the index, middle, little and ring fingers using MRI. Our study was a retrospective observational study that included an analysis of 30 MRIs of the wrist with the hand. A unified MRI protocol was followed in all cases in order to eliminate any procedure-related bias. The calculations were done on coronal T1 weighted MRI sequences using the Medif-Rispax DICOM viewer software. We excluded patients who had any evidence of injury, wrist arthritis, congenital anomaly of the wrist, or those who had a history of previous surgery involving the wrist. The maximum axial length of the phalanx was measured from the condyles to the base of the phalanx. The maximum axial length of the scaphoid was measured from the proximal pole to the distal articular surface along the axis that is required for fixing a fracture of the scaphoid waist, which is the commonest fracture of the scaphoid. We found out that there was a statistically significant positive correlation between the axial length of the scaphoid and the axial length of the middle phalanges of the forefingers, with the greatest correlation between the scaphoid and the ring finger as noted by the Pearson's correlation coefficient. This graph shows the comparison between the average lengths of the scaphoid and the average lengths of the middle phalanges of the forefingers in our study. A scatter plot showed that there was a positive correlation between the axial length of the scaphoid and the axial length of the middle phalanx of the ring finger. Using regression analysis, we obtained an equation to calculate the length of the scaphoid, and the power of our study was 90%. This previously published study, which is a cadaveric study, stated that there was a positive correlation between the scaphoid length when measured from the proximal pole to the distal articular surface and between the middle phalanx of the ring finger. This diagram shows the scaphoid and the middle phalanges of the forefingers as obtained from cadaveric specimens, and the similarities in the lengths can be noted. An early MRI for scaphoid fractures is associated with lower pain, higher satisfaction rates, and reduced costs of immobilization. As per the criteria given by the American College of Radiology, the initial evaluation for a clinically suspected scaphoid fracture is radiography. However, in case the initial radiographs are negative, the protocol is to immobilize and repeat radiographs after 10 to 14 days. But these criteria recommend that whenever feasible, an MRI should be performed in this setting. Hence, if an MRI is obtained in such a setting which has the wrist along with the middle phalanx, just by measuring the axial length of the middle phalanx of the ring finger, we would be able to predict the length of the screw which would be required for fixing the scaphoid fracture in case it is present on MRI. The limitations of our study were as follows. The data was limited to the Indian population. We had intra-observer errors in our study. To minimize these, an average of 3 measurements was taken into consideration. To minimize the inter-observer errors, the measurements were performed by a senior hand surgeon and by a qualified orthopedic senior resident. Further analysis of the images and the calculations was done by an experienced musculoskeletal radiologist. To conclude, the axial length of the middle phalanx can serve as an indirect tool for determining the length of the screw for fixing the fracture of the scaphoid, and to assess the length of the scaphoid that needs to be restored in case of humpback deformity of the scaphoid. Thank you.